Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with small intestine, large intestine, liver, gallbladder, and pancreas ailments, starting with the letter D. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions. Then I'll move on to ailments of the brain and nervous system. Then I'll address issues with the skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood, circulation, muscles, bones, joints, esophagus, stomach, duodenum, small, large intestine, liver, gallbladder, pancreas, kidney, bladder. Then ailments specific to women and men. Then issues of the hormones and the metabolism. And then issues of infections, infestations in the immune system. Then issues surrounding fertility, pregnancy, childbirth, postnatal problems, and special problems in infants, ailments and diseases in childhood, and special issues of adolescence, and finally special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it is recognized that people react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or Arsenicum album types, those who react strongly to Arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature mere people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, gangly, and of stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So let us continue with learning how homeopathic treatments can help with small and large intestine, liver, gallbladder, and pancreas ailments, starting with the letter D. From the stomach, food enters the duodenum and small intestine. The food is then squeezed into the cecum through a small valve, then passes into the ascending, transverse, and descending parts of the colon, or large intestine, and finally to the rectum and anus. The total distance between the stomach and the anus is about 26 feet. The whole journey takes 18 to 30 hours from the time the food leaves the stomach. The liver and pancreas empty their digestive secretions into the duodenum through a common duct, the bile duct. Bile produced by the liver emulsifies fats, and enzymes produced by the pancreas get to work on proteins, starch, and fats. The liver does many things besides aiding digestion. It stores glycogen, a compact form of glucose, and also vitamins A, B, D, E, and K. It removes toxins, for example alcohol, from circulation. It manufactures blood proteins and blood clotting agents. It synthesizes cholesterol, a vital component of all cell membranes, and the precursor of many hormones. It converts saturated fats to unsaturated fats when the body is obliged to use fat rather than glucose for energy. It breaks down and recycles the iron-rich oxygen-carrying pigment hemoglobin. It dismantles excess amino acids and excretes their nitrogen-containing components into the blood as urea. Urea is one of the constituents of urine. It also produces a great amount of heat because of the chemical reactions going on inside it. The pancreas is a gland about 6 inches long, lying beneath and underneath the stomach. It produces large amounts of sodium bicarbonate as well as digestive enzymes. Sodium bicarbonate is alkaline and therefore neutralizes the hydrochloric acid produced by the stomach. It also produces two important hormones, insulin and glucagon, which controls sugar uptake by every cell in the body. The gallbladder has no secretory function. It merely stores and concentrates bile sent to it by the liver and empties it into the duodenum in response to a hormone that is secreted whenever fatty foods leave the stomach. The small intestine has two functions: to complete the food breakdown process and to absorb nutrients into the bloodstream. Although it is only 21 feet long, it has a total absorptive area of about 200 square feet. This is because its inner walls are lined with millions of finger-like projections called villi, each containing blood capillaries and tiny tributaries of the lymphatic system called lacteals. Amino acids, glucose, small fat droplets, vitamins, and minerals pass into the capillaries, and large fat droplets into the lacteals. Whatever remains unabsorbed by the small intestine, about 5% of fats, 10% of amino acids, fiber, some vitamins, bacteria, intestinal secretions, salt, water, all pass into the colon, where it is gradually compacted into semi-solid feces. The bacterial populations of the colon manufacture vitamin K, B12, B1, and B5, and certain amino acids. These are absorbed by the walls of the colon, together with salts, water, and other valuable substances. Transit time through the colon depends mainly on the amount of roughage in the diet. Too little roughage causes constipation and related ailments, such as hemorrhoids and diverticulitis. Diarrhea. Diarrhea is a failure of the large intestine to absorb water from the feces. This can happen with irritable bowel syndrome, where diarrhea alternates with constipation, or gastroenteritis, diarrhea and vomiting, or ulcerated colitis with blood in the feces, or food poisoning, diarrhea and vomiting, or worms and other intestinal parasites, or lactose intolerance and other food intolerance, and even anxiety. Certain drugs, especially antibiotics, can cause diarrhea. Antacids do also because of their magnesium content, and so does a lack of vitamin 3 or folate. Too much vitamin D can cause constipation as well as diarrhea. Liquid stools can also be the price of eating too many legumes or prunes. Chronic diarrhea can also cause a potassium deficiency. If diarrhea continues for more than 48 hours or is accompanied by a fever or blood in the feces, see a doctor within 2 hours. Regardless of the cause, the person may be seriously dehydrated. Orthodox treatment for diarrhea consists of rehydration with electrolyte solutions for 12 to 24 hours, followed by investigation and, if persistent, antidiarrheal agents. A tendency towards diarrhea is best treated constitutionally, although in acute attacks the remedies that follow may be used. Specific remedies to be taken every half hour for up to 10 doses. If the diarrhea comes on suddenly after a shock or exposure to cold wind or overheating in the summer, and the abdomen is distended and the person feels better after passing stool, use Aconite 30C. For diarrhea after a summer chill or after food that disagrees, or after an angry outburst and the tip of the tongue is very red, and the symptoms are worse in the morning and made worse by eating, with painful urination and yellowish-green stools, and there is a lot of wind, and there is difficulty in being able to distinguish between wanting to pass stool and wanting to pass wind. use Aloe 6C. For anxiety and apprehension, with belching and craving for salty and sweet things, use Argentum Knit 6C. For scanty, odorless brown stools that seem to burn the skin around the anus, especially after cold drinks, ice cream, popsicles, or overripe fruit, and the person finds small sips of hot drinks soothing, use Arsenicum 6C. For copious and offensive stools the color of pea soup and the consistency of batter, with a lot of wind and colic, with great urgency early in the morning, and an empty feeling afterwards, use Podophyllum 6C. For profuse watery stools with bits of food in them, and the person feels better after passing them, use Phosphoric Acid 6C. If the need to pass stool propels the person out of bed at 5 a.m. with the anus feels hot and piles may be present, use Sulphur 6C. For profuse stools with vomiting and the forehead breaks out in a cold sweat with a craving for iced water, use Veratrum 6C. For stools like chopped egg with a lot of wind made worse by summer chills or fruit, and the person is very irritable, use China 6C. For diarrhea that is accompanied by spasmodic, griping pains, where doubling up and pressing on the abdomen lessens the pain, and the stools are copious, thin, frothy, and yellowish, and the attack is possibly brought on by anger, use Colocynth 6C. For diarrhea that comes on in damp weather or as a result of getting chilled with exertion and stools are slimy green or yellow and may have blood in them, use Dulcamaria 6C. For diarrhea that is worse at night and is also made worse by cold drinks, onions, and rich fatty foods with no two stools alike, use Pulsatilla 6C. Self-help. To combat dehydration, drink plenty of boiled then cooled water with a little honey in it, or rice water or barley water. This is water in which rice or barley has been cooked. Once the diarrhea settles down, eat arrowroot, tapioca, semonilla, or a preparation of slippery elm bark for a day or two. Then gradually revert to your normal diet. If the diarrhea has been caused by antibiotics, take acidophilus capsules or adophilus yogurt or kefir, or take extra folate and vitamin B for 1 month, and cut down intake of vitamin D, and avoid analgesics or pain pills. Distended abdomen. A distended abdomen is usually due to the retention of wind, feces, or body fluids, as in irritable bowel syndrome, whose symptoms are wind and pain, that is relieved by passing wind or stool, with constipation or premenstrual tension, or after eating too many legumes or beans. It can also be due to malabsorption. In this case, there are pale, greasy stools with weight loss, a lot of swallowing air, and underproduction of stomach acid, with food intolerances, intestinal candidus, etc. Perhaps the most serious conditions signaled by abdominal distension are obstruction, which causes severe pain with or without vomiting, and an inability to pass wind, with fever and appendicitis. If the appendix has burst, or if obstruction or a burst appendix is suspected, call 911. Other distension-related conditions requiring prompt medical attention are retention of urine that is relieved by passing urine, cirrhosis of the liver with jaundicing, or congestive heart failure with puffy ankles that pit when pressed, and breathlessness that gets worse at night and during exercise, and swollen ankles that pit when pressed, with small amounts of urine. If any of these conditions is suspected, see a doctor within 12 hours. Give specific homeopathic remedies that are appropriate to the cause from my videos. If none of the remedies listed elsewhere seems to answer the case, the remedies that follow may be used. Specific remedies. To be given every half hour for up to 10 doses. If there is marked constipation and passing of wind, use Lycopodium 6C. For passing wind with abdominal pain that is relieved by bending backward with bowels loose, use Dioscorea 6C. For hysterical distension of abdomen, particularly after grief, use Ignatia 6C. If the bowels feel as if there is a live animal in them and lots of wind and rumbling, with abdomen distended and there is chronic diarrhea, use Thuja 6C. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.